All right, so welcome back. Today we're going to talk about back pain, and specifically the types of back pain that create radiating pain down into the leg. What we're going to do is we're going to do a couple of different mobilizations that you can use to limit or help to relieve some of your symptoms. But first, I want to talk about just making sure that everyone understands that this is not a replacement for seeking the care of a qualified medical practitioner. Doesn't matter if it's a chiropractor, a pain management doctor, a physical therapist, your primary care doctor. Those people will help you far more than any online video. WebMD is not a doctor. There's a lot of different places where people seek information, and getting information is great, but that is not going to be a replacement for the individualized care that you will get from having an actual practitioner diagnose your condition. We're going to go over how to sort of qualify who is a good type of practitioner, where you should be going, how to evaluate those people once you're actually under their care. But for now, we're going to do this simple mobilization, something that's going to be really helpful for, especially if you have pain radiating down your leg, or if you have lower back pain. So the first thing we need to do is create a testing pattern. Typically, people who have, again, radiating leg, lower back pain are going to have difficulty with flexing forward. So to start out, what we'll do is just test forward flexion. If you can only get to this position, that's totally fine. But I want you to make note of where you get to before your pain begins to start to, obviously, before you get pain, and then when that pain starts to radiate down the leg. Now, once we have our tested position, what you're going to do is, if the pain is radiating down your right leg, you're going to take your right leg and it's going to be away from the wall. So you're going to put your left hand or left elbow against the wall, and then you're just gently going to glide your hips just a few inches towards the wall. Notice that I'm maintaining a good shoulder position as I glide this way so that I'm not collapsing in like this. And what we're going to do is just gently do this mobilization nice and easy for 20 repetitions. Once we're done with 20, we're going to retest our position. If your pain is less and you can get further range of motion, that means that this is your directional preference. This is based on the work of a guy by the name of Robin McKenzie. He's a physical therapist, I believe, from New Zealand. He wrote a great book called Treat Your Own Back. Definitely recommend checking into that as well. But anyway, so we're going to get into this position. If we've created some pain relief from doing that mobilization, this is now your home exercise. You're going to do this for 20 repetitions several times a day. You can't do this too much. It's helping to start to get that disc to be less irritated when you're in different positions, and it's going to help it to start to heal. If that position does not help, there's another way that we can do this, and that is going to be just a straight extension. So now we're going to have two hands against the wall, and you're going to gently glide your hips straight ahead here, just like that. You can also do this position on the floor. So for that, what we'll do is bring the hands up next to the ears and just gently bring yourself to a position where you start to feel maybe a little bit of a pinch. Once you get to there, return to the starting position. If the pinching pain does not go away, that's a good indicator that this is not a good mobilization for you. Same goes for the side gliding position. If you get into that side gliding position and you feel a little bit of a pinch, but it goes away when you return to neutral, that's totally fine. If you bring it into that position and then the pain remains, that's a good indicator that you need to go check out a different type of care, and definitely are going to want to get in to see a, like I said, qualified physician for your care. Again, this is not a replacement. This is a great way to give you a little bit of relief in the process before you end up going to see a qualified medical practitioner. Thanks for watching.